We want to turn here to new data from the CDC showing estimated autism diagnoses are increasing among kids in the United States. 1 in 31 children were diagnosed with autism spectrum disorder in 2022. That's compared to 1 in 36 just 2 years prior to that. Medical experts say this increase in diagnoses is largely due to better awareness and better access to screening and services, as well as a wide range of autism spectrum disorder. This comes as we're also tracking another medical story, an increase in measles cases. Texas now reporting 561 cases of measles. We want to bring in our medical correspondent, Dr. Darian Sutton, to talk about all of this. Dr. Sutton, thank you as always. I do want to start with, what are you getting out of this report about this new autism data? Help break it down for our viewers.
Well, Jay, these numbers are concerning when you look at them from the broad spectrum. In general, autism seems to be increasing. The numbers that were reported in 2022 from the CDC report shows that 3.2% of children approximately had a diagnosis of autism spectrum disorder. Now, as you stated, that's an increase from about 2.7% that we saw in 2020. But just to help break down why we might be seeing that increase, and as you alluded to, scientists and career researchers are reporting that there's more awareness leading to early detection, leading to more diagnosis and more evaluation. I think one of the factors that helped me to understand that, and when you compare, for example, children born in 2018 to children born in 2014, they were twice as likely to receive a diagnosis of autism spectrum disorder. And also as a physician, I think awareness and education has increased, not just from the parents and the patient perspective, but also from the provider perspective. More awareness and what the symptoms look like lead more children to getting into that office and getting that appropriate diagnosis. But as you can imagine, it's variable from state to state, which is why we might be seeing a difference in the rate of autism spectrum disorder when you compare, for example, states like California and states like Texas.
And I want to pivot quickly to these measles numbers, as you heard me mention. What is your understanding of this increase in measles? Does that concern you as well? And what should people do if this is something that concerns them?
Yeah, these numbers are incredibly concerning. And just to provide some context, right now we are on track for exceeding the total number of cases of measles that we saw in 2019. And that would mean that we've broken a record, that we've achieved more cases than we've seen since 1992. Now, what concerns me is that we've seen a decline in the rate of vaccinations. Right now, there's approximately 280,000 children in kindergarten right now that are not fully vaccinated. And although we saw what could happen in places like West Texas, where there are pocket communities with significant under-vaccination, Jay, what I'm paying close attention to are these other cases that are unrelated, but we're seeing popping up in other states, because that West County, Texas area is not the only significantly under-vaccinated area. If you can think about these isolated cases as embers, and when they land on something highly flammable, like an under-vaccinated community, we might in fact see another county, similar to Gaines County in Texas. So that is my chief concern. And what can patients do? And what can people do? Number one, understanding that vaccines are the most highest effective way to protect yourself against measles and the lowest risk. It's so important to understand that 2 doses provides that 97% protection. But as we get more and more children, unfortunately, unvaccinated, we will likely see a spread of this virus. So it's so important to check with your providers to make sure you're fully vaccinated, especially if you're going to travel, remembering that this is not an isolated problem for the United States. We're seeing a rise in about 20% of cases around the world. And also understanding what you might be available to. For example, if you want to get an earlier vaccine, talking to your provider. There are some children, for example, after the age of 6 months where it would be recommended given their increased risk. So being informed, being vaccinated, and just being cautious when you're walking around. This virus is incredibly contagious.
The incomparable Dr. Darian Sutton, thank you as always, my friend.